Hello, good morning. This is Dr. Jamshid from Aster Clinic TCOM. I'm here to talk about Beat the Heat, understanding the heat stroke. So we'll be discussing what is heat stroke, what are its symptoms, when should we seek medical care, how is it treated, and how can it be prevented. So heat stroke is a condition that can happen when a person's body gets too hot. Okay, the temperature usually we say it's more than 40 degrees Celsius or 105 Fahrenheit. So as most people know, it happens when people exercise in very hot and humid weather without drinking enough fluids, and can also happen in people who are not exercising but they have other medical conditions which may be predisposing to conditions where it's leading to their inability of their body to lose heat. So it's likely to affect old people, people who have health problems, young children and babies. Old people and young children, especially, their heat losing mechanisms are not fully effective. And also in athletes, military personnel, laborers who work in the sun. Heat stroke is a medical emergency and it can lead to death if not treated quickly. So the symptoms, of course, the body temperature rises to 105 degree Fahrenheit, 40.5 degrees Celsius or higher. And classical definition of heat stroke means a high body temperature plus brain symptoms. So the person will have some confusion, they're hallucinating, seeing or hearing things that aren't real. They have trouble walking, they may have seizures, they may pass out. So that's why it's called stroke. It looks like a stroke because you have brain symptoms along with a high body temperature. And it can also cause fast breathing, fast heartbeat, redness of skin and warmth, vomiting, diarrhea, muscle cramps, weakness, headache, all these things. So when should we seek medical care? For that, we need to be aware and vigilant for the symptoms of heat stroke. In the right appropriate environment, a person who is exposed to heat or he's working outside and he shows any of the symptoms that I listed can identify. Also, we can identify early if we know what's heat cramps and heat exhaustions, which are basically precursors to developing heat stroke. So cramps, obviously, the name suggests painful muscle cramps can develop when we are working out in the sun too much. Heat exhaustion, many people face this frequently, is while they're walking too much or working in the heat, headaches, dizziness, nausea, vomiting, or they make you thirsty and tired. So these are warning signs which you can identify very early and prevent heat stroke. Also, some people develop heat syncope, which is basically you just lose consciousness because of extremes of temperature. And the last step in that is heat stroke when the things become very bad. The brain symptoms overwhelm all other symptoms. So the main treatment involves, of course, cooling down your body as soon as possible. That's how we do it when you're brought to a medical facility. Most commonly involves using a fan to blow air on a wet skin. We use normal temperature water, pouring cold water over you. Sometimes in some cases we might put on an ice bath, but commonly we use pour water and blow air. And we also do other tests to find out any damage to the internal organs that might happen. Blood tests, ECGs, X-ray, urine test, all these things are done. So most important thing is how do we prevent? When it is hot and humid, the following things can help. Try not to be too active, take breaks when you exercise, drink enough fluids, water sports drinks, electrolytes, and not allow yourself to be, remaining thirsty for long periods of time, and avoid exercising in the mid of the day. Maybe try it out early in the day before it gets too hot. Wear loose, tight, lightweight clothes and not to wear too many layers. Avoid being in a hot car. Avoid letting others being in a hot car, leaving children inside a hot car or old people. Also, I would like to mention people who are living alone, people who need help, psychiatric patients, old people. They might not be able to care for themselves or understand the risks of being in a hot environment, so they need to be special. They need special care. And early treatment of heat cramps or heat exhaustion that you might feel, you can cool your body right down and spray yourself with cold water, sit in front of a fan. Obvious things, move into a shade or air conditioned building, can have a cold shower or bath. Of course, keep yourself hydrated, drink a lot of water, take off any extra clothing, and put a cold pack or cool cloth, especially in the neck, armpits, and groins. So these things can help dissipate heat if you feel exhaustion and can prevent progressing to a heat stroke. So that's it. I'm ready for any questions from your end.
Okay, thank you,
Hello.
doctor. Yeah,
Yes.
thank you, doctor. Let me see quickly if there are any questions today. There's one question. Is there any remedy or any preventive measures we can take in terms of heat rashes? Because heat rash is a very common thing.
Yes.
From a dermatology perspective, or is there any preventive thing you can do first? Or if there's once you get the rash, is there any quick medication, quick way to solve the rash, basically?
Of course, the prevention is the best. Of course, going, taking care of not going out in the heat, and heat rash is basically not exactly in this spectrum. This heat rash happens due to the sweat, and too much of sweat reacting with the skin. And in that case, there are prickly heat powders available which can help reduce the inflammation. And of course, cooling down and removing that irritant will slowly improve the rash. In very severe cases, we have some medicines tablets which we can prescribe, antihistamines and all, which can help in removing the symptoms of the rash. But of course, prevention will be the best.
Understood. There's another question, doctor. Like, there's a member with a situation of chronic migraines, for example.
Okay.
In a similar case, for chronic migraines, it's a very common thing where there are certain triggers like light and heat. So
exactly.
In a similar setting, especially in summer in the Middle East, it's not very easy. So is there any sort of additional preventive measures or additional pain relievers they can do instead of other than the ones that you mentioned already?
Yeah,
because it's going to be a very sensitive situation.
People with migraine are usually very sensitive to such extremes of temperature, be it too hot environment and even too cold environment. And also dehydration itself can be a trigger for migraine. So avoiding all these triggers is what we advise most people who have chronic migraine. And of course, once you get the headache, migraine headache, usually medicines are needed. The usual reliever medicines that the patients use, whatever suits them. There are many options available for migraine. So once you have the headache, taking the medicine is the only way. Otherwise, the cycle does not break very easily.
Okay, thank you, doctor.
Yeah.
Let's wait a few more minutes. If there are any other questions from any of the participants, you can just add those on the Q&A section or the chat section. Just give it a few more minutes, doctor. If there's anything, I'll ask you the questions.
And I apologize for the delay. There was a lot of difficulty in connecting.
There's one question, doctor. Lips are severely damaged from the heat. Is there any special medicine that can be used?
What are damaged?
Lips.
Lips, yeah, the usual lip balms and all, that's the only thing. Body has to self-heal. There are no special medicines for this.
The usual lip balms that you can get from an OTC, basically,
yes.
over the counter.
Yes.
Doctor, is there any connection between, for example, alcohol and the chances of an increased heat stroke, or any other chronic conditions or anything similar?
Exactly. Yeah, there is a connection. There are multiple ways of connection between alcohol. First of all, alcohol affects the liver for those who drink too much, and heat stroke itself is more there are more chances of developing heat stroke in people who have liver diseases or many other chronic conditions, because some of the internal organs are very much sensitive to the physiological changes that happen when there is a heat exhaustion. So the blood circulation is diverted away from the central organs to the skin so that we can lose heat. But in turn, that damages the central organs. So one of the central organ is liver. So if your liver is already weak or damaged because of alcohol, then the progression to heat stroke and its after effects will be very fast.
Understood, doctor. Thank you.
Also, being intoxicated, I would say, it removes your ability to understand the signs and symptoms of heat exhaustion that you may get if you are intoxicated and out in the sun. Of course, that totally makes you a disabled person. So that itself can promote.
Okay. Is there a similar connection, like you mentioned, the weakness within the organs, like in terms of smoking as well, because it affects your lungs and.
Yes, one of the responses of the body towards heat stroke is increase in the breathing and fast heart rate. So for that, your systems have to be at least capable of responding to that. So somebody who is a chronic smoker whose lungs is already not fully functional, I would say that will affect their ability to cope up with the symptoms that are coming on during the heat exhaustion.
Understood. Doctor, can you quickly maybe guide our attendees on, okay, let's say maybe your colleague gets a heat stroke. What would be the first steps for in terms of how they react? What are the first steps they should take in a scenario like this? Or even if you're the one who's getting a heat stroke, like when you understand that you are getting a heat stroke, what are the first things you need to do? And like I said, yeah,
that's what I explained, that once heat stroke has set in, there is a continuum of problems, starting with exhaustion, cramps, and at the end you get the heat stroke. So once you have the heat stroke, you're already neurologically not capable of doing anything. So it's the others who have to identify somebody having a heat stroke. Okay, probably they may be unconscious, probably they may be hallucinating or not in their full senses in any way. So it's the others who have to take action when the heat stroke has set in. So yeah, somebody going to develop heat stroke, the things that they have to take care is about heat exhaustion. We all can identify exhaustion when we are in the heat, or getting cramps when we are in the heat. That's the first sign, and that's the time when we can take an action on ourselves, like the ones that you can see on the screen right now. Cooling down yourself, having a bath, drinking enough water. Preventing that progression to heat stroke is the most important thing, and identifying others is also very important. Once the heat stroke has set in, usually the person is totally incapable. It's the others who have to take action, and usually it needs medical treatment in a facility.
Okay. In addition to that, doctor, so for example, let's say I see someone else is having heat stroke. What are the, as a third person, what are the signs like a different person can see that this person is having a heat stroke? And second is, what are the first steps that the other person can take to help this person? Is it like calling an emergency line, or is it providing them with water, letting them drink water? What are the first steps that they need to take?
So, of course, to identify somebody who is in a heat stroke in the right environment, somebody who is out in the sun or in a very hot environment inside a flat with no electricity. If you see somebody lying down there in the symptoms that I'm showing on the screen, confusion, things that are real, trouble walking, seizures, or they have completely passed out, and you touch them, they are having a high temperature. Now, this for a layperson, this much is enough. there are many differentials that go into our minds when we see such a person in a hospital, because this may be a sign of infection also, this may be a sign of stroke also, or some other thing also. But those things we have to deal with in the hospital by blood testing and all those things to differentiate whether it is really a heat stroke or something else. Also depends on the history of the person who is there. But for a third person, somebody or a lay person who sees such a patient lying down somewhere, not mentally oriented, and his temperature is high, heat stroke should be one of the first things that should come in their mind. And of course, they may have heartbeat, fast breathing, and all those things. And they may, if they are conscious, they may complain of headache, cramps, etc. So of course, then, like I said, the best thing they can do is to use some wet cloths to cool down the body, especially armpits, necks, and all those things, and rush them to hospital as soon as possible. The rest of the things, of course, needs medical care. Once heat stroke has set in, the chances of death are very high. It reaches from 21% to 60%. So other than cooling down the person as much as possible with wet clothes, calling the emergency is the next step.
Okay, thank you, doctor. We have few more questions.
And yeah, of course, if the person is not conscious or semi-conscious, don't ever try to, feed them anything or let them drink anything. They may aspirate. That may create more problems. So just cooling down the skin and calling the emergency, that's the most important thing.
Okay, thank you, doctor. I think we have another question, which I think doctor answered right now. The first line of the state treatment would be cooling down the person, and then it would be calling an emergency response team. We have another question. Exposure to heat stroke for how many years? Like, will it affect, or will it be a cause of skin cancer, or is there any sort of implication?
No. Yeah. There is no relationship as such between, a heat stroke is an acute event that can happen within minutes or a few hours. That's not the level of or the kind of exposure that is responsible for people who have skin cancers. The development of skin cancer has other reasons over a prolonged period of time, and also the type of skin they have, the melanin they have, and also the genetic susceptibility. So that's not something, and also it's mostly some of the cancers are mostly related to the exposure to only UV rays. But heat stroke can happen in any hot environment. So there is no direct correlation between these two things, and one episode of heat stroke has no correlation with the development of skin cancer.
Okay, thank you, doctor. I think that's all we have in terms of questions. Unless anybody has any other questions, they can just pop it up. But I think we are good with the Q&A section as well. So once again, just to summarize, I think Dr. Jamshid covered an interesting area, a very relevant area given the summer in the UAE, in the Middle East in general, and at the same time, what your response should be, the first responses for yourself and for someone else. And I think it has been a very informative session. Once again, on behalf of the doctor and ourselves, I would like to apologize for the delay in getting the live event going on. But once again, thank you, doctor, so much for making your time, taking some time and informing, giving us a very informative session and sparing some time. Thank you very much, doctor. And thank you everyone who attended the session and was patient with us.